Hello everyone. Have you ever seen a patient with memory loss, hallucination, delusion, seizures, and some movement disorders? Today we are going to learn about such condition in which these symptoms are present. Welcome to Medical Guruji. Let's learn about anti-NMDAR autoimmune encephalitis. So what is anti-NMDAR? Anti-NMDAR is an antibody that is present against N-methyl-D-aspartate receptor which is present in the brain, and the NMDAR autoimmune encephalitis is inflammation of brain caused by antibodies which target to this receptor in the brain. So these receptors are very much crucial for synaptic transmission and plasticity. These play a key role in learning and memory. Symptoms include a patient typically present with a prodromal phase characterized by fever, headache and fatigue. These symptoms are followed by more severe symptoms such as psychosis including hallucination, delusion, as well as seizures, movement disorders and autonomic dysfunction. Pathophysiology of this disease, the underlying mechanism involves the production of antibodies against the NR1 subunit of NMDA receptor. These antibodies disrupt normal brain signaling, leading to inflammation and the neuronal dysfunction. Interestingly, about half of the cases are associated with tumors, and most commonly in women, that is ovarian teratomas. Diagnosis of this condition is based on clinical presentation and further confirmed by laboratory tests such as cerebrospinal fluid CSF analysis. In CSF, we detect specific antibodies, that is IgG type, against the NMDA receptors using cell-based assays that are commercially available kits. Second, we can do MRI scans which may show normal or show non-specific findings. A high index of suspicion is crucial. Treatment involves immunosuppressive therapies such as corticosteroids, intravenous immunoglobulins, and plasma exchange. In cases where a tumor is present, surgical removal is often necessary. Hence, early diagnosis and aggressive treatment are key to improving the outcome of the condition. With the appropriate treatment, the prognosis of this condition is generally good, with most patients experiencing a full recovery over time. However, some may have long-term cognitive or behavior issue, which can be confused with schizophrenia. In the summary, anti-NMDAR autoimmune encephalitis is a complex and intriguing condition that highlights the importance of understanding autoimmune mechanisms in the neurology. Keep studying hard and you will be well prepared to tackle these challenging cases in your future medical career. Thanks for watching. Don't forget to like, comment and subscribe for more medical insights. See you next time. Bye-bye.